What's the difference between Medicare and Medicare Advantage? That's what I want to talk about in today's video, so please stay tuned. My name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people understand the Medicare program as well as connect them with the coverage that fits their needs. If you are getting ready to turn 65 and start Medicare, maybe one of the most important questions you're asking is, what are the different parts of Medicare, or what is the difference between original Medicare and Medicare Advantage? I go on a lot of forums. I look at what people are saying about Medicare. That's how I come up with a lot of these ideas for my videos. And I tend to see some of the same questions pop up over and over. And this might be one you have. So in the background there, try to point to it, I have a Medicare and You handbook. That is the 2025 version, but the 2026 version is out. And you might have received it in the mail. And I'll show you what that looks like here, just so you know exactly what I'm talking about. Get it pulled up on my screen here. So this is what it looks like. It just says the Medicare and You 2026, and it says the official U.S. government Medicare handbook. Now, I'm not going to go into all of the ins and outs of this entire book because it is 128 pages long. But what I want to do in this video is draw your attention to page 11. Page 11. So if you have a copy of this, you could pull it up and look at it with me, and I'll duck off the screen here just so you can see this. So there's a lot of people who ask this question online. There's a lot of discussion about this topic, but it is clearly laid out for you in the Medicare and You handbook on page 11 for 2026. So let's just look at some of these things line by line so you know exactly the difference and you can sound really smart to your friends. So as you can see, under Original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the U.S. Under Medicare Advantage, which is a private health insurance plan that replaces Medicare, you may need to use doctors and other providers who are in the plan's network and service area. I bring this up regularly as the first talking point when I do Medicare educational meetings, because I know that so many people value access to providers. Let me say that again. Most people value access to providers. So if you know right off the bat that one gives you more access than the other, then that's going to help you make a decision. Now, some people live in a very urban area where there's plenty of providers and competition is strong, and they don't have any trouble using a Medicare Advantage network. But that is not the case. It varies by where you live. I have family who lives in more remote areas, and not only do they maybe have a hard time finding a doctor that will take their plan, they're having a hard time getting doctors, period. So this is something that you want to keep in mind. Next, you'll see right here, it says, in most cases, you don't need a referral to use a specialist under Original Medicare. Under Medicare Advantage, you may need to get a referral to use a specialist. So that's where you want to know, if you choose a Medicare Advantage plan, how does this work with referrals? Okay, again, just to reiterate, this is page 11 of the new Medicare and You handbook. You can look this up for yourself. All right, let's keep chugging along here and look at some other things. So next, under Original Medicare, Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductible. This amount is called the coinsurance. This is where, or why I should say, people purchase a Medicare supplement. I won't get into that right now, but just keep in mind that Original Medicare is very good, but you are usually responsible to pay 20% of medical expenses when you go to a doctor. On a Medicare Advantage, the out-of-pocket costs vary. Why? Because plans may have different out-of-pocket costs for certain services. And these plans, Medicare Advantage plans, let me just say this, they vary by the county that you live in. So if your county borders another county, the plans available in your county could be completely different than the plans across the street when it comes to Medicare Advantage. My office sits on a border like that, where this side of the street has these Medicare plans and that side of the street has those Medicare plans. So it's something that you're going to want to keep in mind. The other thing to keep in mind is you have to pay the monthly premium for your Part B, and then you can add a drug plan. Under Medicare Advantage plan, you pay the monthly Part B premium, but you may also pay the plan's premium. Some plans may have a $0 premium and may help pay all or part of your Part B premium. Most plans include Medicare drug coverage, so you don't have to have a separate Part D premium. Again, under Original Medicare, you can purchase a prescription drug plan. Just keep that in mind. Next, there's no yearly limit on what you pay out of pocket unless you have supplemental coverage, like Medicare supplement insurance, also known as Medigap. Medicaid can help with that, employer coverage, retiree or union coverage. Under just straight Medicare, though, there's no yearly limit, so there's no cap on the 20% you could pay. Again, that's why Medicare supplements or Medigap plans are so popular. Compare that to Medicare Advantage. These plans have a yearly limit on what you pay for covered Medicare services, which may include different limits for in-network and out-of-network services. Once you reach your plan's limit, you'll pay nothing for covered services for the rest of the year. Okay, so that's something to keep in mind. Under Original Medicare, you can choose to buy a Medigap, also known as Medicare Supplement Plan, to help cover your 20% cost. Or you can use coverage again from a current or former employer, union, or Medicaid. If you choose Medicare Advantage, you can't buy a Medigap plan to cover your out-of-pocket costs. However, you may be able to use coverage from a current or former employer or union or Medicaid if you qualify. So that's something to keep in mind. Let's talk a little bit about coverage now. That's what they go to on page 12. Original Medicare covers mostly medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. Original Medicare doesn't cover some services like routine physicals, eye exams, and most dental coverage. Under Medicare Advantage plans must cover all medically necessary services that Original Medicare covers. Plans may also offer extra benefits that Original Medicare doesn't. So a lot of times what you'll see with that is not prescription. A lot of times prescriptions included vision, dental, hearing, that sort of thing. So just keep that in mind as well. All right, and we've touched on this on page 11, but just again, in most cases, you don't need approval or prior authorization for Original Medicare to cover your services or supplies. Under Medicare Advantage, you may need to get approval, also known as prior authorization, from your plan before it covers certain services or supplies. If you stay using Original Medicare, you can join a separate Part D drug plan. Most Medicare Advantage plans include Part D, and you don't need to join a separate Medicare drug plan. The other thing to consider is foreign travel, and I won't go into that in this video because it really depends on if you're the type of person who's actually going to travel. If you're not a person that's going to travel outside the country, then that's probably not as relevant to you as someone who does. But there you go, just a quick video today talking about Original Medicare versus Medicare Advantage. You can look this up in your Medicare and You handbook on page 11 and 12. If you don't have a copy of this, I'd be glad to email you a PDF version. So just send me a message through my website, just there on the screen for you, meetjamie.com. And if you found this video helpful, would be honored if you subscribe to the channel, hit the like button, and if you have any Medicare questions, leave them in the comments below. Thanks for watching. We'll see you in the next one.